Guys, welcome back to Medical Coding with Blue. Today's episode is all about experiences that help medical coders grow. If you're brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys. So the thing about medical coding and being in this career field is that it not only requires you to develop with your skill as a coder, like with your coding manuals and understanding the guidelines and the rules and the updates and getting better with anatomy and medical terminology and pathophysiology and pharma and all that good stuff. It also takes personal development. Personal development is going to go hand in hand with a successful career, because the more developed you are personally, the more that you are developed career-wise, the more opportunities you're going to have. And the more opportunities you have, the more your earnings potential goes up. Now, we never talk about money and specifics on my channel. I never have and I never will. Because the thing is, I think of it like this. When you are getting into this field, you will be rewarded based on your knowledge, based on your willingness to learn more. That's where you get rewarded. And it does show financially, but everybody has a different picture of what that looks like beginning. Right in the beginning. And for some people who don't want to wait, they get very impatient. Where you start is not where you will stay. And remember, you're still having to learn all of this stuff. So it takes time for you to learn. It takes time for you to grow. But you will not be at wherever you start salary wise for your entire career. And it's short-sighted to see it that way. But if you're developing and having some of these experiences, you'll understand that, okay? So some of the things that will help you to grow into your career and help you to develop that passion and that enjoyment of the field, first of all, is making sure that when you are working at a place, right? Say you're working at a hospital, that you are actively volunteering to be cross-trained in other specialties. The more specialties that you have experience in under your belt, the better off you'll be. Now, I understand that sometimes, like your first job, it may be with HCC or risk adjustment coding. I totally get it. And there's not really a whole lot of movement there. And I always recommend, if you're going to get into that type of position, to at least be there for just 6 months, because that's enough to get you exposure to the electronic health record. It's going to get you that practice with abstracting, pulling out those diagnoses and diagnosis, because it's just HCC, but pulling out those diagnoses and really understanding what it means when they say certain things in the electronic health record. So it's a great place to start your experience, but not a great place to stay, only because you only get experience with the diagnosis coding. Now, you may disagree and say, oh no, this place that I work, they do CPT coding too. Traditionally, HCC is just diagnosis coding. I want to be very clear on that. If they're having you do something else at another place, that may be a hybrid version of something else. But traditionally, HCC is just diagnosis coding only, okay? So again, making sure that when you start in your first job and you are actively either letting your coding supervisor know or volunteering when they say, hey, we need help in this other specialty, not really getting down on yourself because, oh, I don't understand this. Take that as a new challenge that is going to help you to grow. Because when you are in a position that is going to help you to grow, guess what happens? You spending time there, you'll feel like a little uncertain in the first maybe few weeks, but then after that, you'll really start to pick it up, and maybe even just a few days, depending on you, because people learn at different rates. And then again, if you have a good support team with you, other coders around you, or you're learning how to find resources, even just through Google, that's really going to help you to absorb those new specialties a lot faster. And I've always recommended that if you're going to start in a new specialty, maybe you're being pulled out to help in another clinic, maybe you're in family practice right now, right? And they say, hey, we need help over in the ER. Well, that's not so much of a stretch, right? Because the family practice, you see everything. But in the ER, you're seeing a lot of like more injuries and urgency, in the care that's being provided there. So the ER is a great place because it's going to get you exposure to every single specialty because it's an emergency situation. And so you get to learn a lot about that. And then, of course, hopefully you get evaluation and management out of the ER as well. And so that's a different code set for E&Ms versus what you would code in family practice, right? Because that's just your clinic outpatient visits and then your preventative visits as well. So it's a great way to build your resume because you're always having to think about building your resume. And even if you say, well, Blue, I'm really happy at my facility and I really want to stay there, that's great. That's great because you can still gain your experience and move up. But again, it's going to begin with getting as much experience under your belt in different specialties as possible. And the different settings, okay? Like professional fee, when they go up to the floor and they go visit the patients on the floor, and you're coding for the professional fee side, right? And that's under the initial inpatient hospital visits, the subsequent hospital visits, and the discharge. That's what I'm talking about. So those types of visits, the regular clinic visits, the ER visits, same day surgeries, these are all things that are going to help build your resume and get you more experience so that, again, you have those opportunities to go elsewhere. And additionally, if you find that you're going through these different specialties and you like this, you like seeing the variety of the different specialties and things, well, guess what? If you should so decide later on, because you're giving yourself the option, you are not just limited to one specialty, you are not just limited to one type of coding, right? You are exposing your brain and your knowledge base to a lot of different things. So that would lead you to being a lead medical coder or being a supervisor if you want to later on down the line, right? When you have more experience and you start to develop your abilities to work with people. But it will also help you if you want to become an auditor or if you want to become an educator. So that's why getting the groundwork of getting through all these different specialties, and that should be a goal of yours, is to code in every single different kind of specialty. I have done that with the exception of interventional radiology. That's the only one I have not done. But I don't fear it because, yes, I could do it, right? Yes, I could do it. I know it is complex, but I could do it because I have that desire. I love to learn. I don't have a problem. I don't panic when it comes to, oh my gosh, I've never coded for this before. And that's a good quality to have. And if you don't have that quality and you say, Blue, no, I'm really fearful and I'm just really kind of worried, I don't want to mess it up, you're not going to mess it up. If you keep being afraid, you're going to mess it up. But if you are willing to say, okay, I can do my research and they know that I'm starting in this new clinic and I'm helping out, so I'm going to get all the resources that I can. I'm going to talk to other mentors, you know what I mean, that are doing this type of coding. I'm going to try to connect on LinkedIn and connect with other people who code for this specialty so I can bounce some ideas off of them and some questions that I may have. Look for best practices that way. That's a really good thing for you to do so that way you can start to develop your interpersonal skills and you start to learn to communicate better. Because your communication, which is the other experience that you need to develop, is going to be very critical because it's not just coders that we're working with. It's not just your coding supervisor or anybody else in the department. It is working with your providers in the form of queries, in the form of doing coding presentations, right? Education presentations for coding for providers. Not everybody does it. And some facilities, they have a person designated for that. And if that's the case, it's okay. Okay. But you could still volunteer to shadow the person, to say, hey, can I help in any way? Is there anything that I can do so that I can help you with this presentation? And maybe it's just running copies, or maybe it is setting up things. So that way you can observe somebody who's making a presentation. You'll know the kind of things that fall in line with what this facility wants. And then you could be like, hey, this is something that I would love to do. And then you could put your own spin on it, you know, if for some reason you had to do it. Okay, but you would know because you could see somebody modeling that in front of you. All right, and that's what you want to do, is you want to give yourself that exposure to those experiences, because if you don't, and you just sort of say, oh no, I'm just here to collect a check and go home, you need to really think about what you're going to be missing out on. Yes, while that is perfectly acceptable for some people, they have no desires, they just want to just collect their check and go home. It always worries me when people get like that, because I feel like then you're not really looking at what you should be looking at. And you might be a fantastic coder. You might say, I have really good high accuracy scores. I don't need to worry about all this. But what if something was to happen and that you would not be in that position, or that position would go away, or maybe another company comes in and buys out the facility and now you have to have new rules and things like that? You never want to be caught short. And you do that by having that lackadaisical attitude towards advancing yourself. Okay? And again, these actions do not cost anything. Now, I'll talk about some things that do cost. But for the most part, volunteering yourself for other specialties to learn that and to shadow people in those different specialties, because you're helping out in that clinic, that is free, right? That is free. And it shows that you have gumption, and it shows that you want to learn, okay? Working to improve your communication verbally and in writing. The great thing about AI, and this is a rare time you're going to hear me say this, but with AI, they always have like those programs like Grammarly. This is not an ad for Grammarly, but I love Grammarly. I use it on a regular, if not daily, basis, right? For all my writing as well. I'm a good writer. I love to write. However, when it comes to like making sure that everything is just right, some things you can miss, you know, especially if you're writing it as you're thinking it, which is what I do a lot of. I write as I'm thinking it, I'm writing it out. And that is some of the best writing that I've had. And you have to go back through and proofread to make sure. And I've done that. And so sometimes when I run it through Grammarly, it'll tell me, hey, what about this? Or I need to add a comma here or whatever. Those things are very important, because especially if you are sending coding education, which is another experience that you should do through writing, okay? Learn to do that in a very efficient way. Providers like it when you're very to the point. It doesn't need to be all drawn out and saying, oh, I hope you had a fantastic week and I hope your family is, get at what is it that you want, you know? I know you're trying to be sweet. I know you're trying to be nice and endearing, but this is a business and we need to get right to the point. If you have something to say, you make it a very short paragraph. I've always recommended that if you're going to write something, write it out, cut it in half, and then cut it in another half. So you're going to end up with a quarter of what you started with. And that quarter of what you started with is going to be exactly to the point. And that will help your providers to say, okay, this person sending me a message is going to be really quick and it's going to be really efficient. I'll go ahead and read this. Unlike the wordy one, right? That's, you know, doing all this. But working on, you know, your grammar and working on your writing skills. No one likes to see abbreviations as far as like, you know, LOL and things like that. No one likes to see that in messages if you're corresponding with your providers and you're having to send a message or whatever. No one likes to see that. You write out words. You write properly. You are writing to people who have years and sometimes decades of education. High quality education. So you want to make sure that you are presenting yourself well and you are being very articulate when you're writing. Because if you're not, that's going to be the last thing that they will want to read. And I have heard from providers that have worked with me here and who have also left and gone on to other facilities and says, Blue, what's up with these people, these coders that are writing me? I don't even understand anything they're saying. And I'm looking at the message because they send me part of the snippet of the message. And I'm like, ooh, I didn't get this either. Did you not run this through Grammarly? Did you not run it through something, Word, so that way it'll catch all those errors? There's just no reason for it. There's no reason for it. It's lazy, and it's going to, not do anything towards building those relationships with your providers, and that's key. You want to go fast, you want to be a faster coder. Well, it's going to start with those providers giving you the best documentation as possible so that it has the detail that you need in order to be able to code. Because if you have to sit here and query providers because stuff is missing or there's not any clarity to what is actually going on, that takes time. I've always said the anatomy of a query takes 1 hour. It takes time to sit here and formulate the query. Even if you're using a template, you still want to make sure that it's proper and is well written, right? Even if you're just entering in information, right? Because you have to have the proof. You can't just be saying out things willy-nilly. You have to have proof. There needs to be clinical indicators. You need to be writing that in your queries, right? So there's that. You send the message. Now you got to wait. And you take another 15 minutes for waiting, right? And then by the time the provider writes you back, sometimes they may feel a little feisty and they may say, well, I don't have to do this, or, they're coming out with something. And now you got to go walk over there, or you have to set up a meeting if you're virtual, so that way they can understand what you're trying to say, because sometimes people will misinterpret the written word, and they'll misinterpret it because there's no inflection. And sometimes they really don't understand what it is that you need from them, even though you think you're being clear in your coder mind. You think you're being clear, but to them, it's not clear. And sometimes they just have that attitude because their old lady made them mad, their old man made them mad, or their kids did something and they're just frustrated, and you are coming in right at the right time and they're taking it out on you. I'm just saying that it happens, okay? But again, if we are developing in ourselves, we're going to know that not everything is about us. So if you have a provider that gets snappy because you send them a query and they're getting snappy and stuff like that, think about it. It's not about you. It's about them and whatever's going on with them. You just need to clarify yourself. So even if it means dropping by their office, when they have a little downtime and talking it out, that might be a little bit better than writing, because some providers don't like email. I've been told that. Blue, I don't like email. They wanted me back there not emailing them. They wanted a face-to-face visit. And I'm thinking, and I even said this, sir, I know you're very busy. I see you running back and forth to the OR. I don't understand. I mean, I would think that it would be more convenient for you to get back to me at a later time. So I'm going to send you a message because I think that's easier for you. No, I don't like it, Blue. I want, if you need to speak to me, you need to say something, come to me and we'll talk it out, because that will also give me a chance to ask you things if I need to. I said, okay. Okay. So there will be some providers that are like that, And again, some will be like, hey, writing is just fine. But again, you want to make sure that what you're writing is pleasant meaning that it is efficient, it is to the point, not syrupy sweet. Oh, I hope you're doing okay. But no. I hope this email finds you fine. No. What is it that you need? Just get right to the point. A simple greeting, hello, whatever the doctor's name is, or whatever the MP, whatever the PA's name is, boom. And then you get right to the point, and then boom, that's it. You don't have to do anything else. You don't have to dress it up. It doesn't have to be, oh, have a good, no. You don't have to do any of that. Get right to the point. It's a lot better, okay? But developing your writing skills, and if you tell me, Blue, I don't like to write, too bad. Writing and reading is big in coding, okay? Writing and reading is big in coding. The next experience that will help you in your growth as a coder is to actually do a presentation, a coding presentation. Now, again, some places they don't do this, or they have somebody else that does it. But if at your facility you are one of not a handful, because usually these departments are like between 20 and 50 coders. Some will be 60 coders, When I first got here, we were 55 coders when I first got here. And now we are at, I think we're down to 26. So we have gone down quite a bit. A lot of people have retired, have moved, and things like that. So that's the cause of that, you know. And then we've gone through hiring freezes and stuff. So there's a mix of reasons why, you know, we have almost half of the coders that we used to have before, which is kind of sad, you know, because I think the bigger the department is, the better. Because sometimes, like, you know, when you have such a small department, you know, there's not a whole lot, you know what I mean? But if you have more ideas and more people, I think that that's when departments run better, when the department is bigger, you know. But anyway, but one of the greatest things when I very first got here, and I had done coding presentations before for a class of 70 residents. And so that was at my second job, because I had started off at the Cancer Therapy Research Center. I want to sneeze so bad. The Cancer Therapy Research Center, all I did was help with backlog. And then with my second job, I was working at a hospital, and it was a teaching hospital. So they had 70 residents in one class at one time. And so they were like, hey, do you think you can come over and give us a presentation just really quick? We just have some questions. And I was like, yeah, sure, you know, I could do that. And I had been a coder for a few months already, only been a few months, you know. And my supervisor was out, but she said, yeah, go ahead, do it, you know, because I sent her a message like, can I do this? She said, well, you know what you're doing, go ahead, you know. I was like, okay, you know. And so, but standing in front of like 70 eyes, I'm like, oh my gosh, you know. And so I did the presentation, and I was like, does anybody have any questions? Because I don't know, you know what I mean? Like, does anybody have any questions? Of course, I get crickets. I get crickets the first time, and I'm thinking, oh my gosh, you know, like, I hope that you understood what I said. And I'm thinking, okay, well, whatever, you know. And so then after that, they adjourned the meeting. Well, all of a sudden, whew, like I had like 10, 15 people right there. They're like, well, I have, miss, I have a question. I was like, oh, okay, yeah, sure. And so I'm trying to explain, but what about this? No one wants to ask the question in front of everybody. So that's what I learned that day. But giving yourself that opportunity to get that experience and that sort of thing is a good thing, right? So that's something that every coder should experience. Even if you are scared, do it scared. Do it scared. So many people allow their fear to keep them from doing wonderful things and to reach higher potentials in their life. They just let it. I mean, and just the surrender of your power, your own personal power. Because yes, you can. Yes, you can make that presentation. Is it scary? Yes. Is it exhilarating? Absolutely. But that's the fun part of it. Okay? So you should always strive to experience delivering a presentation in front of providers. You should always strive to do a presentation in front of the coders as well, because it's different when you are doing a presentation for providers versus coders. When you are doing a presentation for coders, now these are your peers. This is not a doctor that's saying, like, you know, how dare you try to tell me what to do? And you're like, I'm not trying to tell you what to do. This is the way that, you know, your fellow brethren came up with the rules, not me, you know. But with your coders, you know, you really need to fact check. You really need to fact check. Because if you are just putting together a presentation willy-nilly in front of the other coders and you're saying, okay, this, if somebody sees something wrong, they will call you out. They will call you out really quick. And like I said, when I first got here to my forever home, my supervisor was a former drill sergeant. You want to talk about mean? Like she was a very hard woman as far as like, hey, I want you to do this, this, and this, and this. And it was good because you need somebody like that in that type of position, especially working around so many women and so many personalities. And she kept everything and everyone respectful. She was very good at that, because it is very easy to fall into traps, okay? But she did a very good job. And but one of the things that she told us when we got there was, everybody does a rotation. Every month we have our coding, is a coding education, right? Every month we have that, and we get our CEUs from AAPC and that kind of thing. Cool. Great. It helps me to report my CEUs because AHIMA accepts AAPC CEUs. Cool, because I'm certified with AHIMA. So, but she says, but during this meeting, each and every single specialty does a presentation, and the coders for that specialty, they'll stand up here and they'll do a presentation and they'll tell us about their clinic. I freaking love that. I love that because number one, it gets you out of your comfort zone. Number two, the best way to learn something is to teach it back. And guess who's being forced to have to research and make sure everything's okay, make sure everything's cool? The person who's doing the presentation. And that makes for a better coder, which makes for a more influential department, because now you not only have one person who's a subject matter expert, you have dozens of people who are subject matter experts. And learning about everybody else's specialty is really, really good, because just in case something happens to somebody and maybe they need to go on leave or something happens catastrophic that, they have to be gone for a little while, or maybe they, are off on maternity leave. And so people have to take over and pick up the slack for that person so that the business can keep running. That at the end of the day, that's what it's about too, is the ability to be able to keep the business running and being able to do all of these things. So with that said, having this and doing these types of actions will help you to develop. And it may be the most scariest thing the first time you do it, but trust me, there are other people who will be thankful because you've explained it in a way that is helpful to them. And even if you think, oh, I'm not that good, trust me, somebody out there is listening to how you're explaining it, and it's speaking to them. It is speaking to them. So that's the thing, that you want to be able to do that. When that supervisor had left and moved on to another position, which we all miss her, but she moved on to another position, and it was a few years later after we had moved out of the ancillary building, we had been in the new hospital. This was a few years ago and probably before COVID, but I volunteered to do a training education for the coders, in my team, because we were splitting up the some of the workload, and so injuries is my strong suit. And I was like, please, I was telling my supervisor, I was like, please, can I do a presentation? She was like, I guess, Blue. And I'm like, I was so excited. And then, so what I did was I made the slides for everybody, because I don't trust the monitors up there to do the slides. I gave everybody their packets, and then I brought my candy basket, my bear trap, and it had all these snacks in it and everything. And, I brought that there for everybody, and we took turns. I made everybody else read. When I'm doing a presentation, I do not read from the slides. I'm not going to sit here and read the slides while everybody's just listening and just like not being an active participant. When you are doing education, it's important to incorporate that education with everybody, and everybody needs to participate. And so that's exactly what I made the coders do. And so they were like, oh, okay. So well, I'm not going to sit here and read these slides to you. You all, because I already know what I wrote. I said, but you all are going to read. And I said, we're going to go around the room, or I can call on you. Oh, okay, Blue. And so they start reading. And the feedback that I got was everybody loved it. Everybody enjoyed the presentation. I was like, cool. And I even heard from my boss later. She's like, you did really good. Everybody keeps running up to me and telling me what a good job you did. I'm like, thank you. But that's something that you do to develop. And then the last time that I did it was, but I did this with everybody in the department, was 2 years ago. No, maybe a year ago. No, 2 years ago. It's 2 years ago now, probably. We did the Jeopardy game. And so I incorporated a game with learning, and they loved it. Everybody loved it. And I used the little buzzers and everything. I got the buzzers out, and so it was a lot of fun. And that's a good way to do that. And everybody was asking after that, when we're having our next one. So that was fun. It was fun. And that's what you can have with your career as well. So do that. These are things that you can do for free that are going to help you to develop on being a better coder. And some of the things that, of course, you got to pay for is, after a while, if you find that you want to expand to not just outpatient coding, but inpatient coding as well, start learning ICD-10 PCS. You can go to the public library and see if they have an ICD-10 PCS manual if you can't afford it right now, and see if they have workbooks that have ICD-10 PCS in them. So that way you can practice, you can get that practice in, so that you can start seeing if you want to get a different credential, or a credential like the CCS, which is the gold standard. But even if you have the CCS and you haven't studied PCS in a while, you may want to pick that back up, and just so you can keep that skill and you don't get rusty. Okay. And of course, the other thing is attending conference. If you attend a conference, a national conference, that is one of the best places to, one, make connections, two, to learn. You're going to learn from industry leaders, and you're going to learn from people who really know and love what they're doing. Okay. And that is the best person to learn from, is somebody who really loves what they're doing. Before you ask me, no, I am not attending this year's AHIMA conference in Minnesota, which is going to be in the middle of October. I will not be attending. But if you are attending, enjoy it. Have fun. There's lots to do. There's parties. There's all kinds of free swag that they give you in the conference hall. And then, of course, all the things that you're learning. And then don't be afraid to shake hands and introduce yourself to people, because reputation is everything. I'm just saying. So with that said, I'm going to wrap this one up. Thank you guys so much for joining me. If the video helped you, please like, subscribe, and share. And I'll see y'all next time. Bye.